Right now, if you broke your arm, you'd be in a car, then a waiting room, then an X-ray machine, all within about 2 hours. You'd leave with a cast, a prescription, and a follow-up appointment already scheduled. You've never had to think about what happens without that. But 45,000 years ago, a man in what is now Iraq shattered his skull, lost the use of his right arm, went partially blind, and almost certainly lost the ability to walk without pain. And he didn't die. He lived for decades. No hospital, no surgeon, no prescription. Just a cave, a group of people, and something we've almost completely forgotten about ourselves. We tend to think of ancient humans as people who died constantly and young, fragile creatures permanently one bad day away from extinction, patched together at best, suffering through infections and broken bones with nothing but willpower and desperation. That's the story we inherited. Here's what the bones actually say. The real question isn't how they survived without doctors. It's how they built a system of care so effective that a man with catastrophic injuries outlived most of his peers, and nobody wrote it down because nobody needed to. The answer changes everything you think you know about where medicine actually came from. His name in the research is Shanidar 1. He lived somewhere between 45,000 and 70,000 years ago in what we now call Iraq, in a cave cut into a limestone cliff. When paleoanthropologist Eric Trinkhaus at Washington University completed his landmark analysis of the Shanidar remains, what he found wasn't a clean death. It was a life. A crushing blow to the left side of the skull, probable blindness in the left eye, a withered right arm, possibly paralyzed, leg damage that would have made running nearly impossible, a healed fracture in the foot. Every single one of those injuries showed bone remodeling, the slow, unmistakable sign that the body had time to heal. He lived to somewhere between 35 and 45 years old, which for a Neanderthal was genuinely old. A man who couldn't hunt, couldn't run, couldn't carry his own weight, surviving for years in one of the harshest environments humans have ever occupied. That does not happen alone. Someone brought him food. Someone protected him while he slept. Someone kept him alive long enough for those bones to knit back together. But Shanidar 1 wasn't a single lucky exception. That's what makes this so much stranger. In 2018, researcher Penny Spickens and her colleagues at the University of York published a review in World Archaeology arguing that Neanderthal healthcare wasn't random acts of kindness. It was embedded in their social structure, a normal feature of group life, connected to the deep bonds within small bands of people. Their analysis suggested Neanderthals assisted each other not just after injuries, but during childbirth complications. Before medicine was a profession, it was a behavior. Someone had to bring water, someone had to guard the injured, someone had to chew food soft enough for a person who couldn't chew it themselves. Karen Hardy's 2020 review in Evolutionary Anthropology goes further, tracing medicinal plant use back through the Paleolithic and connecting it to self-medication behaviors in non-human primates, arguing that humans probably didn't invent plant medicine so much as inherit and refine instincts that predate our species by millions of years. The first doctor wasn't a person, it was the group. But that's not the strangest part. In 2022, researchers Tim Ryan Maloney and colleagues published a paper in Nature that stopped a lot of people cold. In Liang Tibo Cave in Indonesian Borneo, they found the skeleton of a young person whose lower left leg had been deliberately amputated. The bone cleanly cut, then healed, then remodeled over years of survival. The person lived for 6 to 9 years after the operation. This was 31,000 years ago. Think about what that surgery required. Whoever performed it had to stop the bleeding. They had to manage infection risk well enough that the patient didn't die of sepsis in a tropical forest. They had to care for that person through what must have been an agonizing multi-month recovery. And then that person kept living for nearly a decade in a foraging community that fed them and moved with them and treated them as worth keeping alive. But surgery wasn't the only thing they understood. The forest itself was a pharmacy, and they knew exactly which shelf to reach for. At El Cedron Cave in northern Spain, a Neanderthal with a visible dental abscess and intestinal parasites left behind dental plaque that researcher Laura Weyrich and colleagues analyzed in a 2017 Nature study. He had consumed poplar, which contains salicylic acid, the same pain-relieving compound related to aspirin. The plaque also carried traces of penicillium, a natural antibiotic mold. He wasn't just sick, he was treating himself. Before pharmacies, the forest was the pharmacy, but only if you knew which plants mattered. That pharmacy is still in your medicine cabinet. The ibuprofen you reach for without thinking, the antibiotic your doctor prescribes after an infection, the instinct to press your tongue against a tooth that's suddenly wrong. All of it has a direct ancestor, and that ancestor lived in a body almost identical to yours. When you feel that pulse of pain in a bad tooth, and your first instinct is to probe it, to want it gone, that instinct is ancient. At Mehrgarh in Pakistan, researcher Andrea Coppa and colleagues found 11 drilled molar crowns in a Neolithic graveyard, published in Nature in 2006. Holes made with flint drill tips in adults who had enough community around them to survive the procedure. 9,000 years ago. No anesthesia, no chair. Just someone who understood that the rot inside the tooth was the source of the pain, and who had learned from someone before them, who learned from someone before that. Exactly how to go after it. You inherited this. The drive to fix what hurts, to care for the person next to you who can't care for themselves, that's not modern. That's the oldest thing about you. But if that instinct was always there, then so was something darker. In prehistoric Peru, researchers David Kushner, John Verano, and Ann Titelbaum examined more than 800 trepanned skulls, deliberate holes drilled or scraped into living human heads, and published their findings in World Neurosurgery in 2018. During the Inca period, survival rates reached roughly 75 to 83%. For comparison, mortality for American Civil War cranial surgery ran between 46 and 56%. Ancient skull surgeons, in some periods, outperformed surgeons operating thousands of years later. And that's the number that sits wrong in your chest. What the data cannot reach, though, is why it worked. Cleaner open-air conditions, refined technique passed down through generations, possible use of coca leaves or datura for pain management. Researchers are careful to say the written record for many of these cases simply doesn't exist. What we know is that the skill improved over time, which means someone was watching, learning, and teaching. What we don't know is what they believed they were doing, what words they used, what it felt like to be the patient on that ground. The open question that stays with you is this: how much knowledge from those 31,000 years of trial and practice was simply lost? And what could it have told us about our own biology that we still haven't rediscovered? That man in the Iraqi cave, Shanidar one, he didn't survive because he was stronger than you. He wasn't. He had a shattered skull, a useless arm, a damaged eye, and legs that barely worked. He survived because the people around him decided he was worth the cost of feeding and protecting and staying close to. The tribe became the hospital. The forest became the pharmacy. The body did the rest, clotting, healing, remodeling, remembering. Before the clinic, before the prescription, before the waiting room, that was the entire system. And buried in your instincts, in the way you check on a friend who goes quiet, in the way you reach for something when you're in pain, it still is. Medicine didn't begin with doctors. It began with the decision not to leave someone behind.